Last Monday, I faced a challenge while booking a surgery with the hospital OT staff. As soon as I picked up the phone and called the OT manager Anjan, he immediately said he was unable to take any bookings and I would have to wait. I asked, "What's the matter?" He replied, "I can't even talk. Call me in half an hour." I rang him back an hour later and asked, "Can you book now?" He, quite a funny and clever fellow, said I had to wait a little bit longer due to a namesake case. He explained that unless he could properly sort out two special patients, he would not be able to take any OT requests anymore. Curious and unsatisfied with his initial answer, I asked him to explain the situation in detail. What I heard was astonishing. On 22nd February, the day I was trying to book the OT, two patients with the same name were scheduled for surgery by two different doctors. The situation was compounded by the fact that the doctors who booked the surgeries had similar names too. Dr. Moumita Chakraborty, a gynecologist, and Dr. Moumita Chakraborty, an ENT specialist. Both had booked two different patients, both named Sushmita Pal, for surgery the same day. These may sound funny to someone, but for hospital, it is a major safety issue. Hospitals frequently encounter patients with the same name and sometimes have doctors with the similar names too. Though these two doctors, Moumita Chakraborty and Moumita Chakravarty, has been practicing for a long time without any trouble, this time the hospital almost faced a crisis due to patients' name being identical. Same names and surnames can be very common, such as Moumita, Shushmita, Chakraborty, or Shushmita, Pal. Similarly, common names outside India include Sarah, Smith, Jones, Lee, and Mohammed. It is not impossible to have patients with similar names, but for a hospital, it is a significant concern, and such incidents could potentially harm patients if not flagged up properly. Hospitals have multiple safety mechanisms to overcome such problems, but it requires special attention. In this case, Anjan needed to call these two patients and two doctors separately to organize the surgeries accordingly. During this time, he had to concentrate solely on this safety matter to avoid any issues on the day of the surgery. He needs to go on to a meditation like clamp down mode where he cannot concentrate on anything else. That's why Anjan could not take the booking for our surgery from my phone call. Hospital staff must study and understand such safety mechanisms very thoroughly. In hospitals, there is a lot of study that goes into this. Some medicines sound alike, known as sound-alike medicines. There are also medications with similar looking ampules, referred to as look-alike medications. Every nurse, when learning the basics of nursing, is repeatedly taught about these 8 R's or 8 rights. Any medication administered must be checked 8 times. Imagine, if you will, you are cooking on 2 gas stoves in your kitchen. Someone tells you that before adding oil, salt, spices, carrots, beans, and every pieces of fish to both pans, you will have to check certain details 8 times before they can be added. If you don't, the person eating the dish could end up in quite a pickle. You might think it's a tall tale, or even consider fleeing the kitchen altogether. Now think about a hospital. Suppose it's medication round time and there is Anusha Ghosh admitted in one ward and Anusha Ghosh right next to her. Or two Nandita Chakrabortys are lying side by side with one surname being Chakraborty and other being Chakraborty. That is the only difference. The problem is one is resting while the other has been in a road accident and is unconscious, unable to even state her own name by mouth. What if one person's medication is given to other? In bed number 303, Mr. Mukherjee was there in the morning, but by night, Mrs. Sen was there. There are some words where patients change by the hour. Or suppose someone needs folic acid, while the person next to that requires folinic acid. Both names sound almost identical. Even the spelling is nearly the same, yet one is just a vitamin and another is anti-cancer medicine. It is absolutely necessary to check, double check, and madly check again 8 times with utmost caution at every step. no room for error. This is known as the rules of 8 R's. First, one must ensure that the medication is being given to the correct patient. That means right patient. It involves asking the patient their name. Nowadays, many hospitals use wristbands with the patient's name. An experienced nurse once mentioned that the best way to identify a patient is to ask them directly, "What's your name?" There can still be confusion at times. So, the practice is to match the patient with their home name or city, known abroad as the first line of address. During my time at medical college, two Rita Roys used to visit busy outdoor clinics. Both had very complex conditions. We referred to them as Rita Tolly from Tollygunj and Rita Bhavani from Bhavanipur to avoid confusion. They themselves knew this naming convention. Though it may sound like a story, such practices often save patients from life-threatening mistakes. Secondly, nurses check to ensure the correct medication is being given, that is, right drug. Human eyes generally read the first and last letters of the words. Then the brain fills the rest. This is why bread and beard can easily be confused. Many neurological studies have been conducted on this, but no solution have been found. Some medications have names or levels that look similar, known as sound-alike medications like dobutamine and dopamine. Folic acid and folinic acid are vastly different drugs. Additionally, some medication samples look identical, called look-alike medications. Therefore, nurses must be cautious while administering medications. Next, nurses must check the dose, right dose. Dosages can be written in milligrams or micrograms, and confusing them can result in hundreds of times more medication being administered. Nurses must remain calm and administer medications carefully. The next check is the right route. This means the correct path for medication administration. The human body has got various orifices and different medications are administered through different routes. A mistake here can lead to a disaster. Some medications are taken orally, some rectally, some vaginally, some nasally, and some orally. Some medications are sucked like lozenges, some chewed, some dissolved under the tongue, and some are swallowed. The story doesn't end there. Some injections are administered at the skin or intradermal, some under the skin or subcut, some into the veins, some into the spine, some into shallow muscles, and others into deep muscles. If you think a nurse's job is tough, you are probably not wrong. But despite everything, they continue their work with love and a smile. The list of R's doesn't end here. When administering medication, one must check the right time for the patient. Right time. Confusion can arise there too. You must check carefully. The differences may be 12 hours, but the real difference is just a letter, A or P, meaning 2 p.m. or 2 a.m. That's why those of us who prescribe medications always use the 24-hour clock format to avoid any confusion. We can never write 2 p.m. We have to always write 1400 hours. The work isn't finished after giving the medicine. Right documentation is required. Which medicine, by which route, and when it was given. Even if the medicine was scheduled for 1600 hours, that means 4 p.m., the patient might be in the washroom during that time. On returning, they might say they will have tea first and then take the medicine. Finally, the medication was given at 4:50 p.m. That must be documented. If for any reason the medications is not given or the patient refuses it, that too must be noted. Additionally, a nurse must keep in mind the right reason for administration of the medicine and the right response. Did any allergy occur? Did the vomiting subside with the antiemetic? Did the blood pressure reduce with the antihypertensive? Or did blood pressure drop too much suddenly? Clearly, a nurse must work with a very calm mind. It is our duty as doctors to support and provide the opportunity for nurses to work correctly. And as patients, we must give them the mental peace to follow the rules. Society, the law, and the enforcers, such as police and government officials, must create a supportive environment for their work. Senior professionals in England used to say, The only guaranteed way not to make a mistake is to do no work at all. If nurses don't work, not a single hospital will run, not even for a single day. The 8 hours are just the tip of the iceberg in a nurse's duty. They have to do much more. They assist with brushing teeth in the morning, to performing cardiac massage or CPR in emergencies. However, Florence Nightingale's successors are yet to receive proper societal recognition for their achievements. Will you do something to respect them? See you soon with another video research.